Hello and welcome back to A Modern Pharmacist. Now, I'll start off with thanking anyone who has listened to the first episode because I'll be honest, I didn't think I'd get that many downloads, especially with it being a new show. So, again, thanks for listening. But this one, we've got a lot to go through, to be honest. There's a lot of things I want to come at in terms of how I'm going to explain it, try and get my points across, and obviously leave a lot of questions for you to try and ponder yourself. And like I said in the last one, this is not for just healthcare professionals. This is for anyone who has any sort of interest in the health and wants to get to the bottom of what is optimal and all these other things that surround healthcare, because there's more than what meets the eye, which I've obviously come to know. And the title of this podcast is Why Modern Healthcare is Failing You. And that is not a clickbait. That is something I genuinely do believe. Now, next month, I've been in the healthcare service for 9 years. And over the last couple, I've obviously become more aware of these situations that I genuinely do believe that statement is becoming more true than ever. And I'm going to try and come at this from 3 different angles. So you'll have to bear with me because I'll have to explain certain things. And hopefully the way I come at it, you might say, oh, actually, that makes a lot of sense. So the first one is, obviously, we've got to understand how healthcare is provided at the moment and what's the history of healthcare. So years ago, and this was before 400 BC, there was this idea that disease and death conditions were all due to the supernatural. And then around 400 BC, someone called Hippocrates come along and said, well, actually, it's something in the air. There's something that's causing this other than the supernatural. So that is where sort of modern medicine sort of was originated from. And that was in existence all the way up until about the 1860s, when they thought, actually, there's something else to this. There's something called microorganisms, and there's the germ theory, where something else is causing this other than bad air, which was the original thing put in by Hippocrates. It then took until the 1920s and then up until the 1940s for them to eventually come up with antibiotics and purify them and basically make them at scale, which is why they were so useful in World War II. And you can see from 400 BC to the Industrial Revolution, I think that was the time anyway, about the 1860s, and then further into the 1920s to 40s, how long it takes medicine to catch up with what is actually happening. And the new sort of frontier for medicine, which it should be taken on, is that we've got enough data now to understand where diseases and conditions originate from. My specialist area is cardiology, it's in metabolic health, and there's clear evidence that 80 to 90%, depending on where you look, of these conditions can be prevented through really good lifestyle, exercise, all these other things, which I'll come on to later. So it would make sense that we make the transition from being really good at treating something to let's make sure that it doesn't happen in the first place, which is where I believe, and I've always said for the last few years anyway, is that's where medicine should be going. However, there's something that is in place, which we'll come on to, sorry, in terms of why we may not be going towards that way as a system, because that is the most logical way forward. And that is the first way in which healthcare is failing you, because we clearly know what causes a lot of conditions now. So why don't we change our way of managing it from treating it really well to actually preventing it from happening in the first case? So the way that most things work in the world, sadly, is due to money. And I've seen it firsthand in healthcare. A lot of the things that we get asked to do on a daily basis is, can we save the NHS money? And some things I agree with, because yes, it is a taxpayer's system. There's, again, a lot of politics to this, which I'm actually going to touch upon in this episode. But when you need to save something in terms of money, that is fine as long as there is a reason to do so. And an example is anyone who takes blood thinners, so for an irregular heart rate. So they're called anticoagulants. So a lot of people might be aware of something called a apixaban, a doxaban. And there was a thing last year, and this is just like a bit of anecdotal advice or evidence. So we were advised to change everyone from a apixaban to a doxaban. And the reason being is that it's going to save the NHS money and all these things. I actually refused in my GP surgeries because unless there's an actual compelling reason or there's evidence to say this is going to benefit your health, I don't want to do that, because there's a good chance that I change someone's medication, they come back, have a heart attack, a stroke, whatever it is, and they say, do you know what, I was fine on the one before, you changed this because of this. And that was the case with the Doxaban. It was that the company who was making it was providing an app for the NHS. They were given extra money towards screening, I think it was. There was a lot of politics in place. Basically, they were getting funded for it, which we weren't seeing at our level. It was just going to the top dogs, whoever it is in the NHS. This year, fast forward, we are now being advised to switch back from a Doxaban towards a Pixaban because it saves the NHS a lot more money. Obviously, there's been a disagreement with the funding, and this is a clear sort of example of how funding in the NHS and how the world is basically revolving around money, and it's not really to do with patient care. So I refuse to do that, but that's an example because what I come on to now might actually baffle you in certain ways because it baffled me. So keeping this idea that essentially everything's based around money, which a lot of people who aren't naive will understand that, is that from a business point of view, if you want to save expenses or grow as a business, you will try and invest in areas where initially it might have a bit of a startup cost. However, the idea is that it's going to make your business more efficient, and in the long run, it will give you greater results. It will improve costings, all them things. And the NHS is a big, massive business. And in terms of NHS England, these figures are probably going to be out by a bit because it's normally delayed by 18 months to 2 years. But NHS England, give or take, spends and gets allocated about £202 billion a year. And how that's spent is absolutely ludicrous. 50% of it's on wages, which, I don't know, given the level of professionals in the system, I think that's probably a big waste. But my point is, why don't they put that money into prevention? And this has always been talked about. So there's this thing called the NHS long-term plan. It's probably within other major countries of the world as well. And preventative health, believe it or not, is in the top 3 priorities and has been, I think, since about 2015. Yet in 2026, the budget over the past decade has decreased by 27%. And then when you look at that in terms of spend in comparison to the total budget, less than 3% of that budget for a top 3 priority is being spent on prevention. And that's me even including research and development of certain conditions, which technically doesn't fall under prevention, but I'm going to be kind and allocate it there at this moment in time. And I was like, okay, well, if it's such a priority, or they're going to say cost is a big thing. So where is that money getting spent? So I had another look into these things. So medication, obviously massive. Now, 4 out of the top 10 medications are due to weight loss, metabolic health, or cardiovascular health. There's probably more, actually. I've just been very kind on that. The number one cost with regards to medication on the NHS is Mounjaro, despite the fact that we turn away so many people and they get it privately. And that totaled £574 million, which is insane. The next one, or within that, I think it's actually number 3, is Wegovy. That was 137 million. And then I was looking into other things in terms of costings, just to get my point across of why we should be looking into preventative health and why the system's actually failing you. So the cost of a heart attack, again, hard to nail down, but it's about £10,000 a year per patient. And then the cost of strokes towards the NHS as a raw cost is 3 billion. And then I think to the wider economy, it's 4 billion, obviously through other services, work lost, all them other things. So if you just take Mounjaro, Wegovy, and stroke as a cost, and you divided that into what would that be in terms of gym memberships, preventative health, that would account for 123 million gym memberships at a cost of £30. Now, the UK has a population, I think 67 million, so give or take double the population. So you could have a gym membership for everyone, and this is including kids, by the way, so that wouldn't be the exact figure, and then give them at least one PT session a month. I'm pretty sure that you will, given the fact that 80 to 90% of these conditions they're prescribed for can be completely avoided if you have really good lifestyle in place, that money would be better spent that way. But obviously they see it as we need to treat when they are sick. So I looked into it a bit more, and I've just got quite a few notes here. That's one thing that I have improved since the last one, is that I needed to have more notes. So I was looking into what does the NHS determine is a viable way to spend their money. And it's something called a QALY. So it's a quality adjusted life year. So essentially the concept is, if you've got drug A, actually I'll go back. It's basically how much does it cost for someone to live an extra life at full capacity. And that means if you are, so for me, for example, my 100% life would be to go to the gym every day, move, be able to eat food. That is what I consider 100%. So for me to live an extra year at that level is one QALY, and that might change for other people. It might be for someone's nan being able to walk to the shops and not be in pain. That would be one QALY for them. And what the NHS does is they allocate 20 to 30,000 pound per QALY, and that's how they determine whether it should be placed on that or whether they take that funding and put it into something else that they feel as though is going to give the system a lot more benefit. Fair enough, there's got to be some sort of classification in order to make sure that there is a level of fairness per se. So I looked into health screening. So I don't know whether this figure's right. I don't know whether the NHS are going to disclose these things, but the NHS do a health check for 40-year-olds up to 74, I think it is, which is a generic blood pressure, does your cholesterol. And then if you are in a high risk category, and I'm assuming that's due to family history or whether your BMI is really high, you then get access to a HbA1c, which is a diabetic marker over the past 3 to 6 months. Give us an idea what's happening with your blood sugar. That costs £179 per patient, apparently, which I don't think it does because, again, I own a blood testing company and I don't feel as though with the time spent and the resources that's being used for that, I don't feel like that's the cost. However, let's go with it. And they found that screening these people for these conditions in order to prevent cardiovascular disease, which includes heart disease, diabetes, strokes, all these other things, is related to a £900 to £3,000 per QALY. So that fits well within the 20 to 30,000 pound. And I was like, okay, well, fair enough. That shows that it's working. Why don't we look at the age group below this point where we're trying to advocate more for? So the people in the 20s and 30s, where clearly stuff is happening at this point, probably more than ever. There's more kids now. I had a patient the other day who was 23. Well, he was 27. He's got really bad diabetes type 2. Off the scale, his weight was 150 kilos, but at 23 developed heart failure. Again, many other complications that could have potentially been avoided. So what's the data on that? And essentially there is no data. So we don't have this in place because, not because it's not cost effective, just because they've never ever studied that. And when you actually weigh up what the NHS spends its money on, which I just said then, in terms of strokes, heart attacks, the medication, it also went through a few other things where mental health come up, and I didn't know whether to include this in the podcast because mental health, as you know, is a very personal subject to a lot of people. It's quite a touchy one. However, we spend 20 billion, I think, within the UK, within NHS England, this is, so it's not including Northern Ireland, Wales or Scotland. However, it was 20 billion, which is over 6 times the amount that we spend on preventative health campaigns, which are stopping smoking, reducing alcohol. It makes no sense. You should stop it if you want to really improve your health. However, different conversation. Weight management and all these other things. So we spend 6 times more on mental health. But there's a lot of studies, and you've probably been made aware of these, is that exercise, good lifestyle habits are just as effective, if not more effective, for treating depression and anxiety than most generic medications that we prescribe from the GP surgery, because we just basically load a lot of people on them and there's no real incentive to come off them, and there's no real incentive to improve your life when you go on them. So my arguments would be, if we improved all the cardiovascular health by improving access to gyms, access to healthy eating, I'm going to come on to something actually which was quite surprising. And if we increase the money into them things, it would then reduce, in my opinion, the overall spend in mental health. It would reduce the overall spending in medication. It would improve the quality of life for basically the whole population that is being treated for it. Yes, there will be people that need medication and help, but that will be a minor fraction of what the country is experiencing at the moment. And then you get a really healthy NHS system where everyone is going in there to thrive and not merely survive and just come out the other side patched up and just sort of left alone. So that is something to ponder. I always think it's clear that the NHS is a mismanaged organisation. I don't feel like it's going to be here for much longer. I've said this numerous times. I just don't think it can, when you look at all the figures in terms of like 50%, give or take, is spent on staffing. And when you look at the level of staffing in the NHS, it's pretty poor. When you look at everything from an objective point of view, it is, in my opinion, a system that's put in place to be managed declined. And it's sad for me to say that because I feel like there are some really good benefits of having this system in place. There's some really good healthcare professionals in there, but it's not allowing them to thrive and it's not supporting their environment. But going back to what I said before about these preventative health campaigns, they spend, I think, about 3 billion. I couldn't really find the exact figure. When they are doing these campaigns, it is very poor. So the reason I'm bringing this up is I had a clinic on Friday, and it was to go through lipid lowering. So essentially, are people on the right dose of statin? Which again, I think I spoke about last time. It's not my first sort of action is to put someone on a lipid lowering therapy. However, it was to look through this guideline. So I went through it, and given the fact I've just told you that 80 to 90% of these conditions that are caused by high cholesterol, metabolic dysfunction, high levels of inflammation, stress, all these things, 80 to 90% of those can be prevented if you reinstate really good exercise and diet. You would expect 80 to 90% of that guideline to be really thorough on these points, essentially giving you really tangible advice. However, it's the inverse. 90% of that guideline was how to dose, how to manage and monitor a statin effectively. Now, obviously, I read through it. I could basically go through everything about a statin for anyone who wanted to know. But the point was that it was for healthy eating advice. They sent me to a website. On the website, NHS governed again. It was a joke, really, to be honest. So it said in terms of fluids, you need to have 8 cups of fluids a day. That could be tea or coffee. So that's telling everyone if you're going to have fluid, you can just have 8 cups of tea a day and that's suffice for your health. That's clearly not the case. It was really ambiguous. There was no direction, and you can see why people don't have a clue. And the level of care that's given in the NHS is very, very substandard. Like I keep saying, the consultations, if someone's level of fat is high in the blood or the weight is a bit too high, don't eat this instead. And it's like they probably have cheese once every blue moon. Like not having cheese or certain foods are not really going to drastically change their health, but they fixate on these things anyway. The exercise said, please follow guidance as per the UK Chief Medical Officer. I've actually I've looked at the advice and I've never looked at the person who's provided the guideline because in the large majority of cases, these people have never been to a gym in their life. They've never exercised and they say do all these things when they've never done it themselves. So I just straight away, just my bias is that it's a very, very poorly written document. It's about the aerobic activity, which I agree with, but give it a give it in a tangible way that people can understand. I need to do this at this level, at this intensity, this many times a week. If I don't do it this many times a week, what is the minimum dose or the minimum amount of times that I can do it to get a good response? There's so many different things to it, but right, so let's try and go back to where I was. So the first point, I'll try and make this a bit more smoother, was the first point was modern healthcare is failing because it's slow. It moves at a glacial pace. It took us from 400 BC to 1860s to then 1940s. And then now when we're living in an age of more data, more evidence than ever, we're not acting upon it. And it then goes on to my next point because it's all to do with money. If we cured a lot of these things, if we put money in certain areas, does that bleed money from certain pots that have got too much to say within these organizations, within these guidelines? Because when you know the medicine and all the physiology and you read some of these guidelines and you think, why is that being pushed more than others? That it makes no physiological sense. When you look at it from a business point of view, you go, okay, it makes sense because then it allows these conglomerates to continue to function. A lot of the spending is on things that we can prevent. And I'm going to do an episode on GLP-1s, but Mounjaro, £574 million. And that is from the NHS and their spending. It's not to do with all the private. And I would probably be giving it an underestimate if I said I see an extra 5 clinic letters each day about someone who's had a private GLP-1 prescribed. I'd then probably see about 1 to 2 cases, no, probably 3 to 4 a week from side effects from the pen because, again, they're being misused. But, again, it's all to do with money. But the last point I want to say about why modern healthcare is failing us, is we fail to acknowledge what is actually going on in the world. So if you think about the average patient that we see now, and I was discussing this with Jess the other day, was that when we treat patients now, I feel like we have two completely different consultation models. If I speak to a patient who is 60 plus, I have a different approach to someone who is 40. And that is because they grew up on different times, they were under different impressions, and they are less likely to be following these new biohacks and all these other things. So 60 plus, it's normally they've followed certain diets and they do certain levels of activity. It's merely a case of whatever I see on their blood work is a direct reflection of what they're doing in their lives. So it's a pretty easy consultation in them terms. When you see someone now who's younger, there's a lot of people who are taking peptides. That is the big craze at the moment. That is, someone said before, I think it was Jess, it's the AI of the medicine world. And it is, or they are. So a lot of these results that you're seeing, are they due to a GLP-1 pen? Are they due to certain supplements? Are they due to certain alternative therapies? And as a medical cohort, obviously I'm a pharmacist, so I go under the General Pharmaceutical Council. You've got the Nursing Council, Dental, and the General Medical Council. All these people really need to be aware that people are doing these regardless. I was speaking to or overheard people in the gym before. Basically, they're using anabolics, they are using every peptide you can think of. If you don't educate yourself on these things, you can't give optimal care to these patients because that level of testosterone that's coming through to you is more than likely given through exogenous ways. So, how do you manage that patient? All these metabolic markers that are coming back, HbA1cs, normally in the 30s, are coming back in the 20s through the GLP-1 pen. How do you manage these patients? You can't just say, I don't agree with these, they're off label, they're off market, we're not going to deal with that because they're going to still go into the NHS through A&E maybe, where you had a potential chance to interact with these things. So that's why modern healthcare is failing. You don't have to agree with certain things, and I don't agree with a lot of things that are done even in medicine, but like peptides, I don't agree with the whole philosophy around them. I can see why people do them, but I don't really agree with it. But to not agree with it and completely ignore it then means that I'm not training or providing optimal healthcare to these people when they're coming in with, I don't know, BPC 157, retatrutide, whether they're coming in with certain types of testosterone. You need to know what they're taking, how it works to a good degree, and how you can manage these patients because at the end of the day, they are still patients, and that is the whole point that you sign up for, is to give optimal care. And that's actually one of the reasons why I've done this title, so I'm going to come on to this point. But the NHS is very much stuck in its ways, and it just really baffles me that as a corporation, as an organization, we can just send, I don't know, no comment, or we are not going to comment on these things because it's from a private source. It's completely, it's near enough barbaric, it's near enough negligence because people are going to do things. I don't agree with that people should be able to smoke. I don't agree with the fact that people should be able to drink large amounts of alcohol. But when these people come to us through the NHS, we say, do you know what? We're going to treat you for pulmonary fibrosis due to smoking, or lung cancer due to smoking, or liver cirrhosis due to drinking excess alcohol. But if someone comes in the doors through a heart attack through testosterone, or even before that point, they say, can I get my blood work done with you because I'm on testosterone? No, we don't support them treatments and we're not going to go and do it. What's the difference? I think if they're being proactive, and these people, by the way, who are using on a large scale of these alternative therapies tend to be in better health. So if you engage with them, like I've said, the whole preventative model, you're probably going to de-escalate a lot of the things that could potentially happen 5-10 years down the line, which is then going to cut your costs as an organization. It's going to improve everyone else's health. It's going to improve everyone else's knowledge, because there are so many things that are coming out where we're further advancing our knowledge. And someone said to me the other day that, did I agree with something because it wasn't FDA approved? Now, for those who don't know what the FDA are or is, it's the Food and Drug Administration, and it's based in America. They are the regulatory body for anything that's medicinal, essentially. So if they give it the green light, it's normally been tested in the right amount of people, and the benefits normally outweigh the risks. And a lot of these therapies are not FDA approved. So people say, oh, you probably wouldn't agree with that. And I was like, well, Even if it was, you need to understand why is that being approved, and you've got to look a bit deeper. And because it's being approved by a regulatory authority, it doesn't mean it's correct. Obviously, we know about a lot of scandals that have happened through maybe vaccines or thalidomide, early morning sickness, that obviously led to really catastrophic events. So because something's being approved through a governing body doesn't mean, if anything, it probably makes people question a few things more. But the comment I'm going to finish on, again, I've got my timer there, I'm conscious of the time, was I did a post on LinkedIn, and it was to do with, it was just it wasn't an analogy, it was just me to get my point across. So I said that I prescribe statins, so on and so forth, but I can't order the tests for the right amount of people in order for them to get actionable insights into their health. This consultant, don't know where he was from the UK anyway, said, I don't agree with mass testing. If it's from a private source, we will report it, say no comment, and we are not to interfere with it. And I thought, has this, and later went on to say that there was no evidence for the LPA marker that I was referring to, which there is. Look at every set of papers, guidelines, even the guidelines say it, which is ironic because that's what they normally go off. It's a lifetime test. But that the NHS doesn't support certain testing under certain ages because of the chances of finding things. And it just really opened my eyes to the sense that these people are genuinely waiting until people are on death's door before they intervene because it says in a guideline. Like, use your common sense. You have to take your car in for an MOT after 3 years if it's a new car, and then every year. You don't take your car in just when it's broke. You take it in to just make sure everything's going well with it. You do that with a lot of things in life. You don't just, I mean, some people might do. You don't just leave your bank account from one day at the beginning of the month and then wait until the end of the month. You normally check to see how it's going, what's the projection, is there anything that's come out that you don't expect. But when it comes to testing and health in the NHS, we're like, oh, well, no, it's not in the guideline. We're not going to look after them. Makes absolute no sense whatsoever. And that is my message from the beginning. If you are young, 20s, 30s, regardless of age, but this is more pertinent if you are young, you should always be more invested in your health. Try and get it tested as soon as you can. Don't listen to these people that you don't need to get tested until you're 40, because that's a load of rubbish. There is no way of saying that. The earlier you get tested, the more experience you get with your body. Everyone is individual. Bear that in mind. When you look at a lot of studies, a lot of data, I always explain this to people, is that we take one drug or one intervention, we then put it into a group of thousands of people, hundreds of thousands, and then from that point, we think, okay, well, it's performed like this in the average person. And then we expect it to work in every single individual that we then prescribe it or we intervene with, which, if anyone understands basic human biology, every single person's is different. They have completely different DNA, and that is how you need to look at your health. You need to make sure that you know what's making you optimal, what is your baseline for certain things. And when I say this, it's not a plug to come and test with me. It isn't. It genuinely isn't. It's about going, even getting a free blood pressure, go and buy a blood pressure monitor, go and do the easy things, and just know where your health is, because genuinely, if you left it up to the system that's in place now, you would not be getting looked after, and the wrong people are getting seen first because of the way the financial landscape works within healthcare. And also, I genuinely don't believe it's going to be here for too much longer. Well, like I said, anyway, that it was meant to be a weekly podcast, and ironically, this is going to be my second in a week, and I think I'm going to keep it 2 episodes a week as long as I can. For every podcast that I do, this was for informational purposes only. It was not medical advice, and you should seek that of your healthcare provider. And obviously, based on this episode, if you can even get in with them, or if it's financially viable for you to book an appointment, which I don't think it is. The question I will leave you, I don't know whether I can do a poll, is, do you think modern healthcare is falling behind? I surely can't be in that camp, even if those who are working in healthcare, surely you can agree that this system was fit for purpose maybe 50, 60 years ago. It is no longer fit for purpose, especially the way that things are moving in the world. And we need to make sure that we change our practice. Otherwise, people aren't just going to use the healthcare. We're going to go down different routes and modes, and it's not going to be here. But anyway, if you got this far, thank you very much for watching and listening, and I will see you in the next one.